Hello everyone, my name is Zainab Abba Ibrahim. I'm from Nigeria. I was diagnosed with metastatic breast cancer. That was last year, February to be precise. So I came here and I met with the oncology team, and I was placed on chemotherapy and also immunotherapy. Then I also, after the first 3 cycles, I had a PET CT and I had a partial response. I had 5 sessions of radiotherapy to my femur, and after which I had another PET CT, and it was good. So I want to say thank you to the oncology team, Dr. Ranga Rao, Dr. Tanvi Sood, also the surgical oncology, Dr. Brudra, and Dr. Aditi for the support and also a good prognosis to my treatments.
Hello friends, I am Dr. Ranga Rao, Chairman Medical Oncology in Paras Health, Gurgaon. We had this patient, Mrs. Zainab, who's come from African country, and when she came here we discovered that she's got a breast cancer and this has already spread to the brain, to the bone, and then is a huge tumor in the right breast. And then we analyzed the whole tumor and we found that she's got one type of breast cancer which is called as a HER2 positive and also hormone receptor positive. We planned the whole treatment. First thing we did was we had a discussion with each and every one of our team, the medical oncologist, the radiation oncologist, the surgical oncologist, the PET scan specialist, the radiologist and the pathologist. And then we came to a consensus that we should be getting after this cancer, one after the other, tackling the different things in her cancer. So first we tackled the brain, we tackled the bone metastasis, and then we gave a systemic treatment which is a chemotherapy, targeted therapy, and then after that we had the hormonal therapy, and she also had a surgery for the breast which is unconventional. And today we are very fortunate to see her that she doesn't have any trace of cancer after almost a year and a half, and we hope that she stays very well. Wish her all the luck and the best of luck to her.
Hello everyone, I'm Dr. Tanvi Sood. I'm a consultant medical oncologist at Paras Cancer Center in Gurgaon, India. She's a young lady, she was premenopausal. We also offered her ovarian suppression, which is achieved easily with medicines these days, with subcutaneous injections along with hormonal therapy. So once we started out her treatment, we also realized that she has bone metastasis. We involved a radiation team also for the palliative radiation to the bone so that she does not get any fractures. And parallelly, she was given systemic therapy with chemotherapy with 2 types of anti-HER2 drugs which are now easily available in even a subcutaneous injection, very convenient for the patient. The patient had a very good result after 6 cycles, after which on PET CT the disease was almost disappeared, and we were even able to offer her surgery for the breast mass which had a rather slow healing. So we call that as something like a toilet mastectomy. She had a wonderful healing after her systemic therapy, and now after 1 year also she's still on follow-up with us. She comes to us very healthy, very confident in herself.
Hello everyone. I am Dr. Aditi Agarwal, Senior Consultant Radiation Oncology at Paras Hospital, Gurugram in India. Now when she came to the radiation department, the issue was of giving radiation to her metastatic sites. The most important site was the femur, which is a weight-bearing bone which needed radiation. Though it was a small lesion, but it was lytic, which means the bone was weak and it could break. So we decided to give her stereotactic body radiation therapy, that means SBRT, which means that we gave a high dose of radiation per sitting, and the entire treatment was completed in 5 sittings of radiation. This dose is ablative, which means that it intends to completely eradicate the disease at that point. The response assessment scan that was done showed that there was complete response on that site. At present, her PET scan shows that there is no disease in her body anywhere. So she is doing very well. That is how, if we use multimodality treatment, patients can be disease free for a longer period of time, even if it is metastatic. Thank you.
So the patient Janab was referred by the medical oncologist for metastatic breast cancer. On local examination, there were some skin ulceration on the local site, which got healed during the neoadjuvant chemotherapy. And the patient was referred for surgery, so we did a modified radical mastectomy with axillary dissection. And to our surprise, everything was under control, and the patient was discharged on 5th day. And ultimately, now patient has come for follow-up after a year, and she has completed all the chemotherapy, everything, and radiotherapy, and that led to the complete cure for this patient. And the final take-home message for this type of patient is that there is around 40% chance of cure even in metastatic breast cancer. So we are proud to treat such patients.
Paras Health, partners in health.